Today I shall be talking about Paget's disease. This is also called as osteitis deformans. In Paget's disease, there is excessive bone resorption by osteoclast, followed by excessive bone formation by osteoblast. And the bone formed will be a fibrous bone. Which will be cancellous bone of larger volume. This bone is also called mosaic bone. Causes: paramyxovirus, it most commonly occurs in the males of more than 50 years. Three stages is seen in this. First is incipient stage, also known as lytic stage. As the name says, lytic stage, so in this there will be excess bone resorption by osteoclast. Second is mixed stage, which is active. In this, both osteoclast and osteoblast activity is increased. Third is inactive stage. Which is also called late stage. In this, osteoclast activity is decreased, but osteoblastic activity is still continuing. So it is called blastic stage also. Talking about clinical features, we have mnemonics for that: @panics, there will be pain in the bones and pain in the joint. Arthralgia, pain in the joint. As there will be too much bone formation by the osteoblast, there will be nerve compression. Mostly 2, 5, 7, 8 cranial nerves will be compressed. There will be increased in bone density, cardiac failure, as there will be too much bone formed by the osteoblast, so cardiac So heart have to pump more blood to supply that extra bone. Sclerotic vertebra. Now talking about investigation in X-ray. In lytic stage, osteoporosis circumscripta, candle flame sign, blade of grass sign. As this is lytic stage, in this osteoclastic activity will be high. So like this is the skull bone, and here will be the empty space due to the osteoclastic activity. Bone resorption will occur, and it is called as osteoporosis circumscripta. In candle flame size, suppose this is femur and this is tibia and fibula. This part of the bone, in the middle of the bone, there will be empty space, as it causes as osteoclastic activity is increased. So it will look like candle flame sign on the X-ray. In mixed stage, there will be picture frame vertebra. What is picture frame vertebra? Suppose this is the vertebra, but in X-ray, this will appear more white, and this will be less white than periphery. This will look at more white due to increase in sclerotic activity, due to the more osteoblastic activity, due to increased sclerosis. Eventually, all of the vertebra becomes white because in late stage osteoclastic activity will be decreased and osteoblastic activity continues to work. So all vertebra become white, which is called ivory vertebra. Cotton wool skull. Suppose this is a skull and the bone will increase like this. This is due to increase in osteoblastic activity. The bone thickness of the bone will increase, which is called cotton wool skull. Third late stage is blastic phase. In this, there is too much bone formation by the osteoblast, which will lead to canyon of compression, mainly the 2578. Tam O center sign. Tam O center means increased head size. As the osteoblastic activity continues, the bone continues to grow, and the patient will need greater size of the head every year. And in this, alkaline phosphatase will also be increased, as this is the marker of bone formation. Talking about the treatment, bisphosphonate is the treatment of choice. Teriparatide, parathyroid hormone is not given, as it And for surgical treatment, we need to perform osteotomy to relieve nerve compression. It's all about Paget's disease. Thank you.